recommendations for fasting while we're breastfeeding. So if the infant is less than 4 months and the infant is being exclusively breastfed. So the World Health Organization recommends that under 6 months, babies should be exclusively breastfed. And we know the benefits of breastfeeding, right? But after 4 months, you could be introducing solids. So that's why I'm saying that if an infant is less than 4 months and it's being exclusively breastfed, so it's not having any formula, it's all nutrients coming from mother's breast milk, then if the mother does fast, then there is the risk of dehydration for the mother, because a lot of fluid is required to be producing breast milk. Right? And then there's the risk of decreased milk production. And if you have decreased milk production, I know it's a supply and demand. The baby could be irritated, it could be hungry, it's asking for milk, you're trying to give, but you don't have enough supply because you're fasting. And then the risk of weight loss in infants, especially, I mean, that's a special category. Like if you've already had an infant that has been on the sort of the lower percentile of the weight gain, and you know, their weight has been being monitored and they're on that lower sort of 10th percentile, and now you start fasting, that could really impact the child's growth. So in these instances, it's advisable that a woman does not fast and she would be excused from fasting, right? If an infant is more than 4 months old, or an infant is less than 4 months, but he or she's not being exclusively breastfed, then, you know, in these instances, the infant has other sources of nutrition, but there is still the risk of decreased milk production. So let's say if the mom is like 5 months, the baby's 5 months, and you know, the mom wishes to continue breastfeeding and she's already been struggling with milk production. Now, if she were to fast, that dehydration would most likely, you know, lead to decreased milk production and possibly, you know, stop milk production. So in these instances, I mean, here, it's still not, yes, you should be fasting. You know, have a discussion with your healthcare provider and what's your personal preference, and then decide based on that to fast or not to fast. And then if the third category is mother with no underlying medical conditions, in keeping with postpartum, so mother does not have diabetes, mother does not have anemia, you know, her blood pressure, if she was hypertensive or she had preeclampsia, is now well controlled, she has no postpartum depression, she's feeling well, the infant is, you know, like we mentioned, on other sources of nutrients, and she wishes to fast, then it's advisable that she does fast, but still to discuss that with your medical healthcare provider.